Welcome to Playful Beginnings, a podcast about the magic of play therapy for therapists, students, and anyone interested. In our podcast, we'll explore the deeper understanding of play therapy and the skills we use when working with children.
We hope to help you understand the why behind what we do and how it helps kids heal and grow. I'm Dr. Christy Opiola, a working play therapist and university professor in North Carolina.
I'm Dr. Maggie Parker, a play therapist and professor in DC. All right. Good morning.
Good morning. Hi, Maggie.
Hi, you guys. We're so lucky today to have an amazing and spectacular play therapy expert as one of our guests. We have Dr. Regine Chung. She is an assistant professor at University of Houston. I'm sorry, Texas State. My apologies. I made that mistake before. Texas State. She is also a founding member of the board for Child-Centered Play Therapy International and a trustee of counselor education for the Association for Child and Adolescent Counseling, has published numerous studies on child-centered play therapy. And I think one of the most exciting studies that we've seen so far, and really what we hope to talk about today, is a longitudinal study of child-centered play therapy with children who were diagnosed with ASD or
Autism spectrum disorder.
Thank you. Whew. All right. So welcome. Yay. And also a fellow graduate of UNT. So one of our circle,
Yeah, close colleagues.
Close colleagues. Yeah. So welcome.
Hello, everyone. I'm very excited to be here. I listened to this podcast and I'm really grateful for this opportunity to come on to share some of my experiences with you all today.
Awesome.
So, Regine, tell us a little bit about your experience as a play therapist and what made you interested in this population in particular.
Well, so a little bit about myself. I actually was born and I grew up in Hong Kong, and that's where I first learned play therapy through some professors who graduated from UNT. And after getting my master's degree and having very minimal knowledge about play therapy, I decided to take another certification course in play therapy, which later on got, opened doors for me to work in a special school. Well, several special schools in Hong Kong where they have this huge need for play therapists, but working with children with mild to moderate intellectual disabilities, and many of them also have a comorbid diagnosis of ASD. So that was the time when I thought, okay, I really need to learn more about play therapy and see how play therapy can be helpful for autistic children or children with developmental delays. And then it was more through supervision and my own reading and maybe getting some additional trainings during that time to really experiment what that looks like. So initially the journey was more on a bumpy road because I was learning as I was doing it, and then there was not a lot of research or materials that I could study specifically from a child-centered perspective. I decided, okay, I need more training, I need more supervision. I decided to apply for the doctoral program at UNT, and I got in. And my passion for working with autistic children continued, and that led me to create a study for my dissertation, and particularly exploring the impact of child-centered play therapy with this population. So I would say this is a very long answer, but then I guess in a summary is that I didn't choose to work with this population, but I did. And then it was through the actual clinical experience as well as the experiments that I did throughout continue to fuel my passion, and I just really want to do more for them.
Yeah. I think this is kind of the experience for a lot of people, especially after they get their master's. Not everyone is able to have the opportunity to do research and have someone watch their stuff and be manualized and all of this. And you were kind of like learning as you were going. And it seems that the more you were doing it, the more you realize maybe I should learn some more so I can do it. But you were seeing the benefits of it as you were doing it.
Absolutely, especially because for autistic children, people often see the diagnostic criteria, the autistic behaviors such as the rigidity, the repetitive behaviors, and also their impairment and deficits in social skills. So therefore, a lot of the professionals or specialists, whether it's coming from the occupational therapist world, therapy world, speech and language therapy, or behavior therapy, they're very targeted on targeting those specific skills to teach these kids. And what I'm seeing as a gap in my experience working in this kind of interdisciplinary support or intervention team is that CCPT really fills a gap that we focus on helping the child to build self-esteem. We're addressing social and emotional concerns that are not limited to the ASD or the diagnostic criteria, but we're really addressing the mental health aspect of what is it to be on the spectrum. And also in my years of study and research, I'm also really, reminding myself to move from this more medical school conceptualizing this disorder into recognizing neurodiversity as well as doing advocacy in helping parents, teachers, and autistic individuals to embrace and this identity and also to recognize that the impairment being on the spectrum is not only on the individual levels, but also to recognize how it is a struggle for being autistic, especially living in a world that's built for the neurotypical, built by and built for neurotypical populations.
Yeah, when it seems so many things are trying to, I don't know if this might be too strong of a word, but change the individual to meet the system. And CCBT is trying to uphold and honor the individual, not trying to change them, or it's just how, recognizing their innate capacities. And I don't know, I guess that's how I kind of interpret it, but I'm not sure if that's kind of how you do as well.
Oh, absolutely. That before I became a child centered play therapist, in my training in counseling, I was more of the traditional and more old school training program where we are expected to identify with a counseling theory, and my counseling theory is person-centered counseling. So even philosophically, I really appreciate person-centered counseling or child-centered play therapy and its emphasis on facilitating that innate capacity for individuals to grow. And that is such a unique healing factor when working with autistic children, because when you think about autistic children, you know, let's say in a more ideal situation that their needs and their behaviors are being spotted early on and they're receiving early intervention. And what you would expect is that as they're going through different interventions, there will be constant instructions, constant corrections, and many of which will send a message that they are pressured to act in a certain way. And that can be really demanding as well as very confusing, especially for a young child of constantly receiving this message of I am only accepted when I engage in certain behaviors or to act very unnatural. My sensory needs are telling me that I need to engage in certain behaviors. My need for control and predictability is telling me that I need to do things in a very specific way, or from the outside, we're seeing those need for predictions or need for routine, and it is being perceived as odd behavior, or the need for rigidity, right? So the mismatch between how the young child is being seen as well as how the child is perceiving or experiencing themselves create that discrepancy, can lead to vulnerabilities, anxiety, this low self-worth, and power struggles between the child and the world or adults, right? So these are things that, from a mental health perspective, and specifically from a person-centered or child-centered perspective, that I really find it really helpful to use this conceptualization to understand what the goals in therapy can be, other than just focus on how do we correct the child or how do we change those behaviors that are atypical or not normal.
Right.
It made me really think about, the foundational belief within child-centered, which is, you are enough. And what I'm hearing is that they may get a lot of messages that they are not enough. They are not okay. There's something wrong with them. And I can imagine, I'm excited to hear more about what you found, but that idea of being in relationship with someone who is giving you a very different message that you are enough, you are valued, you are treasured just as you are. We don't, that you aren't requiring them to be any different, had to be such a disconfirming experience for them, right? To disconfirm this idea that there's something really wrong with them or put all this pressure. I can imagine just philosophically about how powerful and healing that that message may be. And I know it's not the intentions of the other therapies
Mhm.
to give that message, but if we are always correcting, if we are always putting a demand on the child, that could be how they're interpreting that message because what their body is telling them they need, right? Is
Mm.
being contradicted with what the world is telling what we need from them. And then in play therapy, in a relationship that is safe, that is confirming of who they are, right? My guess is that you may see something different than the other therapists or teachers or aides saw within these children. I'm curious, did you notice
That's what I
changes
was going to
in the
ask. What did
play
you notice in the
therapy room?
playroom?
Notice. I'm just curious, as a
You see.
clinician who sits in a room with a child who has ASD, what might be things that I'm noticing? Because we hear a lot of messages that child-centered is not the right approach for ASD, right? I mean, I don't know if you do in your area. I know we do in my
I do.
area
And
that,
I called Regine last year because they're telling
yeah,
me that I can't do this.
Uh-huh.
yeah, and that they need maybe more ABA or more behavioral interventions, because that is the gold standard right now for AD or ASD. But my experience has been different. So I'm just curious what you noticed in the playroom for children at these same timeframes. Because my guess is maybe you were seeing shifts too, or maybe you didn't see shifts and the shifts happened outside of the playroom first. But as play therapists are doing this and may feel discouraged or, they're getting messages that their work is not good enough, what encouragement would you have for
Yeah.
them?
Yes, in my work with clinicians or trainings or whenever I share the 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 theory behind it, I always to encourage play therapists to think about those six conditions that we emphasize in child-centered play therapy is continue to assess that psychological contact within the relationship. Even though when we look at the definition, it says, okay, as long as it's there, that you meet the requirement. But then with autistic children, what I have noticed is that deepening of the psychological contact, and as the child is receiving the therapist's core conditions, you see that the relationship is really deepening. Starting from the child seem to be not really concerning about what the play therapist has to say and just really immerse in their own play. You may notice that they may be, in terms of the proximity with the play therapist, they just don't feel the don't feel comfortable staying in very close proximity, or they will choose to stay away from the therapist, have their back facing the therapist or avoid eye contact. And these should be accepted fully in recognizing and respecting the child's
Mhm.
readiness to engage with the therapist. However, we continue to output our core conditions. We use our facilitative skills and our body language to really convey that I care about you and I'm interested in what you are doing. And what I've noticed with children who initially seem to be building this, invisible barrier with me would be more willing to engage with me, even if it's just, looking back
Yeah.
when they heard me said something that seems to fit with how they're experiencing, to later on moving to to want me to follow what they're doing. I've had children inviting me to play with them, have reciprocal play that was not initiated by me, but by the child. And then even with the types of toys that they choose, and specifically regarding how we can do things together. I've had kids coming up with a game for us to play together, and they would cheer me on. I've had a child wanting to take care of me, doing the doctor's kit, which is something that we see in other children too. In many children who comes to play therapy, they really use the toys to show their affection towards the therapist and that social need. And I would say it's a myth for people to think that autistic children are so into themselves that they do not have social need. I would say it is more so they are so scared and confused about relationship because of the predictability, or sometimes it can be a sensory thing that is just too overwhelming for them to receive a lot of the social cues or the sensory output from another person, leading to, okay, I need to step back and to assess what's going on. But in terms of whether or not CCPT works, do they really get the relationship? I would say 100%. When I did the study, it was me and two other play therapists, and of the over 20 students who participate, we seldom have a difficulty having the child follow us to the playroom. Except if maybe initially the first 1 or 2 sessions, they may be feeling very cautious about who are you. But many of them, majority, I would say, vast majority of the students who participated in the study is after the first session, they immediately recognizes the play therapist, and they're willing to go to this playroom again in their second session. So that speaks to the child really recognizing the difference when interacting with the play therapist as compared to other individuals or maybe other adults, and that there is this, what we call is the social validity of this intervention, is that the child actually enjoys coming to play therapy, and that they feel that this is a place that I want to be in. This is a relationship that I want to engage in.
Yeah,
I have some.
it's beautiful. Go ahead, Christy.
I was just gonna say I have a few supervisees right now who have a kiddo on their caseload that has ASD, and it's been such a joy to watch just the transformation of the relationship in the play space. And I think sometimes the play therapist, I don't want to say that they didn't realize it, but that the fruition of watching this child engage more and really show fondness for the therapist as well as their own capacity. Because one person I'm thinking of, they were told this kid is a runner, right? So they will try to escape the space as much as possible. And so we worked really hard to adapt the room. We did a lot of problem solving. What do we need to do to make this space feel more sensory healing than overwhelming? It has, it's in a school setting, so it's got lights, the fluorescent lights above it. It's noisy. It's all sorts of things. And so with the play therapist and I were just kind of problem solving things that maybe we could do. And it's fun to watch how much those changes made a big difference in the playroom.
What? Oh, sorry. I was going to say that was kind of one of my questions, right? Is what adaptations might be important or useful? Something you said, and I know this is really concrete and something Christy and I have talked about before, is if a child has their back to you or is not wanting to engage. I think in the book, it talks about how you want to move your chair so that you can see them. But this may be a time where it's maybe this child does not need me to see them right now, and they need to be practicing this alone, and how can I support them? And so I was kind of curious, what adaptations, if any, did you make to the room, or what kind of things were you thinking about? As I think that sometimes the book is very helpful, right? But if the relationship is most important, then sometimes we have to deviate in order to uphold that relationship. And so I was kind of curious about what, if that happened with you. Long-winded question.
Okay, sure. Yes, absolutely. I love to answer that question and to share a little bit of what we went through as a research team
Hmm.
to modify the playroom, the setup, as well as going back to your question about if we believe that CCPT, the healing factors within the relationship, what does that mean in the way that we interpret play?
Hmm.
Specifically, play behaviors that come up that are more um, uh, that may can be more repetitive or more rigid, right? So we're now going to go back to what you have asked, Maggie, about the playroom adaptation, right?
Hmm. Yeah.
So during the study, because the study was taking part in school, so the plays that we did, the Chalcena play therapy sessions were in these classrooms, some of which are a portable classroom where students come to those classroom for after school program, or sometimes they have some kind of, teachers may be using the classroom for work, etc. So within a larger classroom, we were able to section it and make a play corner. And I would say, in terms of the size of the playroom, it's around maybe 100 to 115 square feet, where we have this play corner with the typical three categories of toys in CCPT. And I, as a CCPT therapist, I really think it's important that we include multiple categories as well as items from each categories in the playroom to start with, because I do want to send a message to children that even though you may have special interests, or maybe you only want to focus on a specific toy, and that's okay, but I do want to give you the options that if ever, whenever you decide to play with some other toys, that's readily available for you to play with. However, I would say in terms of the quantity of toys, or specifically the sensory, because of the sensory needs of each child can be different. Adjusting the quantity of the toys as well as sometimes specific materials that are selected for the toys are something that were considered throughout the study. For example, I have some children who are really into sand,
Hmm.
and you can see how this is such a sensory fulfilling experience for the child to play with the sand, and a lot of, okay, I just really want to bury myself in the sand, right? And that can be both satisfying, but then also creating almost a sensory overstimulation for the child, that you see the child maybe starting to feel dysregulated towards the end of the session. So those are the moments that made me become aware of, okay, perhaps I could reduce the amount of sand that's available, that the child does not get a sensory overload. In terms of the lighting that Christy was sharing, I think it is a valid aspect to look into. I have older kids who were very mindful of, okay, entering into the playroom and wanting to turn off the fluorescent light and only turn off the flashlight in the room. And that's something that I allow the child, and I am okay with the child to do, especially because we do have a window in the playroom. So even when the lights are turned off, it's not completely dark. So recognizing that these children has an idea of what fits them best is something that I invite the child, and I'm giving permission for the child to really experiment what works best for them. And with that child who knows to turn off the lights each time when he comes in the playroom, another thing that he did was that instead of staying in that play area for the entire time, he really didn't like staying in that small space. And what he preferred to do was to collect toys from the play area and then play with them on a different table, which is still part of that classroom where we were. And because he was older within my study, he was one of the older kiddo, and he was also taller. So I completely understand that for him to squish himself in the play area may not be the most comfortable way for him to play. So that was something that I will not set a limit on. Hey, in the play, during the playtime, you have to stay in this play corner, right?
Yeah.
So being very attuned to the child's need as well as being okay with the need for flexibility is something that I continue to explore. And then also with the idea of recognizing that children who autistic children who struggle with, the sensory processing issues, I'm really being mindful, especially because me being neurotypical, I can only learn more about what they need through observing what was going on in the therapy. So I tend to be very observant instead of having, okay, these set rules that needs to be applied to everybody. Of course, I have a consistent, overall idea of determining safety, determining physical boundaries, but then being mindful of the child's their receptivity in terms of sensory stimulus in the room is something that I remind myself to do. And that can mean that instead of setting that rigid limit of, okay, everybody has to stay in this box or stay in this space during the playtime. I find that allowing the child to pace around that classroom space sometimes can be really helpful, especially for the pacing. I feel is both self-regulating as well as allowing the child to decide what is the proximity that they feel most comfortable between themselves and with me. So these are the considerations. And then the last one is with the materials. I know some autistic children, to explore toys with their mouth, they would put things in their mouth. I would be very mindful of having and not having small pieces in the playroom, such as even with toy cars or animals. I want to make sure that, okay, these are really durable toys, no falling pieces. And then in terms of those sensory toys, like fidgeting toys, I try to find those that are multi-purpose. Let's say I've seen this in many playroom nowadays. For example, that sensory is the worm, and then it's also allow the child to fidget with it. Those type of toys, I feel it fits both the category of being an animal, or kind of the child can fidget with it, and at the same time, it can be an object to be used in a symbolic play if needed. So these are things that I consider to be helpful when building a playroom or building a play kit. How do I minimize the cost, but at the same time fulfilling the needs of the children, both on a sensory level as well as if they want to engage in symbolic play. So I'm not purchasing, okay, one box of sensory toy, one box of animals, one box of this and that. So I try to see if, these toys can be in multiple categories if possible.
Yeah. When it seems just being really aware and cognizant of and I think that's one of the things, and I think you're part of that book, as was Christy, on the multicultural playroom of how can these things serve multiple purposes for multiple children in different ways. And, some of the things that Christy and I have talked about that I think that align with what you've talked about in the playroom of, okay, how is this going to be an overwhelming space? Does this feel too small? How can we be flexible if you're in private practice or if you're in a community agency? What flexibility do you have afforded to you? Do you need someone or Christy and I talked about a tent where they can retreat if they need to, or how many paintings are on the wall and how many colors and how many, so
Yeah.
really trying to be aware, even what smells are present in the space.
Oh, yeah, absolutely.
Yeah.
I had a question just as you were talking there, Regine. I was thinking about, I don't have a very big playroom. So you were talking about pacing or moving around, and I'm wondering if sometimes the fleeing out of the playroom could be because the space is not big enough. But then do you know what I mean? But then you're not in a private, secure place. There's other people around. Do you know what I mean? There's so many pieces to that question, but I'm just curious for you, have you found, because we all don't have a luxury of having a big playroom, right? How you may adapt based on the size of the space that you're using. Are there any kind of guidelines that you kind of go by when you're thinking about that for kids as they're in the space and wanting to meet their needs, but also being constricted by, just the environmental space that you're in.
Yes, I've had kids refusing to go into the playroom because in one of the playrooms that I use for the study, I have darker curtains, and then these little kids, the younger ones, I think they were the one that who really was showing, I don't feel comfortable going in with a 4-year-old. And what I did was I removed a curtain and later on replaced with a lighter color. So that is a small change, but then it still doesn't answer your question because you asked about the space. Like, the physical space is too small.
But I think anything that, sometimes we don't think of in our spaces, it doesn't, we chose what we put in our playroom for the
Oh,
most part, right? And so to us, it feels fine as neurotypical
yeah.
beings, but it may be a challenge for children who are on the spectrum or
Mhm.
others who have neurodiversity that we don't think of, and we just claim it to be part of their diagnosis when really we're not setting the environment up so every child can be successful.
I wonder if it is possible to rearrange some of the furniture so that within the small space you can maximize the empty spaces. That I was also wondering about, with the number of toys, would it be helpful? It's not really a guideline, but then if let's say this is a small room, instead of stuffing the room with and every single item listed on the play therapy room toy list, right?
Mhm.
Could it be possible that maybe you reduce the number of toys and still keeping those categories, the 3 categories, so that it feels less crowded in
Yeah.
the space, pushing all of the furniture to against the walls of the playroom so that there is an empty space in the
Mhm.
middle. I have had one of the kiddo who was in the study. We were in a very small space, but then the child really needed to run, and we ended up just running in circles around the sandbox. So I feel part of it is we can make this space, we can do something to change the space, but then also sometimes kids, when they feel it, they may utilize some space in the way and if they want to play chase with you, then you make adjustment not just to the place, and then mentally you have to decide, do I go along and do that with the child?
Yeah.
Yeah. Not a specific guideline, but then I feel we need to be creative with what we have and be flexible.
Yeah. No, I think that's really helpful advice. I was thinking we're kind of in a closet. So, that's the size space that
Mhm.
we're in a school setting. So the school gave us a closet size space. So you can only make the most out of a
Mhm.
closet that you can. But we're already following a lot of that.
Mhm.
Yeah. And I could talk to you about it personally, but I think there's some other things that inhibit our space that we may be able to make small adaptations to make it more friendly.
Mhm.
Yeah.
Yeah.
Yeah. Well, this was so helpful. I really appreciate you coming on. I think just for our listeners to see what you've noticed in the playroom, how you've seen it work, parents, I think is really beneficial.
Well, I'm glad. I'm glad that you find it helpful. I feel like I'm just going on and talking about all kinds of things, maybe not in the most organized way.
That's pretty par for the course for this podcast. We get on a topic and then we get excited about it. Well, thank you so much. We're so lucky to have you. And so everybody, yeah, listen and read her studies, and we'll post those to our website, or not to our website, but in the newsletter. So if you want to get our newsletter, go ahead and subscribe and through our website. You can email us at info@playtherapyspace.com, or Christy at playtherapyspace.com, Maggie at playtherapyspace.com. If you have any questions for Dr. Chung, you can reach out to us and we can facilitate that. And yeah, this was lovely.
Dr. Chung will be speaking this summer at UNC Charlotte's Multicultural Play Therapy Conference. So if you want a more in-depth exploration into play therapy with children on the autism spectrum disorder, come check us out.
So, well, thank you so much.
Thank you for having me.
Bye.